My name is Elisa Dowdy. This is my head to toe assessment for summer 2025. It is May 13th, 2025. This is the ceiling. This is my room. This is my patient and my supply table. I'm gonna start my assessment and I'm going to assess the skin throughout the assessment. I'm looking for color, temperature, texture, bruising, lesions, moisture, turgor, edema, scars, and nevi. Then we're gonna move to the head and the face. We're looking for size and symmetry. Your head is normocephalic and is symmetrical. We're gonna move on to the hair. We're looking for color, distribution, and texture. I'm feeling for any masses, tenderness, lesions, depressions, or infestations. None are noted. We're gonna palpate the temporal arteries and sinuses for tenderness. And then I'm gonna palpate the lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. All right, I'm going to palpate TMJ. I'm looking for subluxation, tenderness, and crepitus. Open and close your mouth. All right, now cranial nerve 5, which is trigeminal clench. All right, perfect. Now close your eyes and tell me where I'm touching.
Forehead, left cheek, nose, chin.
Okay, perfect. Now cranial nerve number 7, we're looking for facial symmetry. Smile, frown, pucker your lips, puff out your cheeks, raise your eyebrows, stick out your tongue. Perfect. All right. We're gonna move to the ear. I'm inspecting for size and position. I'm palpating for tenderness. I'm palpating the pinna and the tragus for masses or tenderness. I'm inspecting the auditory canal and tympanic membrane. Auditory canal is pearly gray, red light reflects. Pearly gray, red light reflects. Okay. Cranial nerve number 8, vestibular cochlear. I'm testing your hearing. Plug your right ear. Tell me what I say.
1, 2, 3.
Plug your left ear.
1, 2, 3.
All right, now I'm testing lateralization with the Weber test and air and bone composition with the Rene test. So tell me if you hear it everywhere or in one spot.
Everywhere.
Okay, tell me when you stop hearing it.
Stop.
Okay.
Yes.
Okay.
Stop. Yes.
Okay, perfect. Moving on to the nose. It is midline, it's straight, there's no deviations. Cranial nerve 1 is olfactory. I'm going to test patency. Plug your right nostril. Tell me what you smell.
Perfume.
Okay, plug your left nostril.
Alcohol.
Okay, perfect. Moving on to the eye, I'm checking the lashes, brows, papillary features. I'm looking for lesions, discharge. Conjunctiva is pink, sclerosis is white like it's supposed to be. I'm going to check her acuity here with a Snelling chart. This is cranial nerve number 2. Cover your right eye, last line.
LLTHP.
Left eye.
LTFPH.
So now both eyes.
LTFPH.
Okay, perfect. Now tell me, I'm checking her peripheral vision. Tell me when you can start to see my hands.
See them.
Okay, perfect. Moving on to cranial nerve 3, which is ocular motor. I'm testing direct and consensual pupil response. Okay, response to light, perla. Now I'm going to test for accommodation and convergence. Follow my finger in the 6 points of gaze. Okay, all right, now look at the wall and back at my finger, and then the wall and back at my finger. Okay, so cranial nerve 3, 4, and 6, which is trochlear and abducens, are intact. We're going to move on to the mouth. I'm inspecting the teeth, gums, buccal mucosa, palate, tongue, floor of the mouth, salivary ducts, posterior pharynx, and tonsils. Stick out your tongue. Okay, tonsils are present. Perfect. Now I'm going to move to the cranial nerve number 9, which is glossopharyngeal, and cranial nerve number 10, which is vagus. Say ah, stick out your tongue.
Ah.
Okay. Perfect. Palate, the floor moves up and down. It is intact with no fasciculations to the tongue. Stick out your tongue, up, down, left, right. All right, that's cranial nerve number 12, which is hypoglossal. We're gonna move on to the neck. The trachea is midline. There's no deviation. I want you to, I'm gonna check the thyroid. I want you to swallow. Okay, now swallow again. Okay, all right, now I'm gonna auscultate each carotid. I want you to hold your breath. I'm checking for bruise, okay? Hold your breath. Okay, hold your breath. All right, perfect. While I'm here, I'm gonna go ahead and test the accessory nerve, cranial nerve number 11, shrug your shoulders. Perfect. Let's turn it around and start with the posterior chest. We're looking for signs of respiratory distress, use of the accessory muscles, tripod flaring retractions, tachypnea, cyanosis. We're looking, there's no deformities. We are symmetric. First, I'm gonna palpate for chest expansion. Breathe. It's even. Now I'm gonna do tactile phrenitis, say 99.
99, 99, 99.
Perfect. Now I'm going to percuss all intercostal spaces. One. Now I'm going to auscultate. Okay, now I'm going to check for egophony with E. So when I touch you, say E.
E, E, E.
I'm checking bronchophony with, no, bronchophony with E, and what's the first? Egophony is with 99, bronchophony is with E, so do 99.
99, 99, 99.
Now bronchophony.
E, E, E.
And whisper pectoroliloquy. Say 1, 2, 3, and whisper. Perfect. Now I'm going to check for CVA tenderness while I'm here. No? Okay, perfect. Turn around. We're going to do the same thing for the anterior chest. We're looking for any obvious deformities or signs of distress. Everything's rising and falling. It's symmetric. We're going to palpate for chest expansion. And then tactile phrenitis. Say 99.
99, 99, 99.
And I'm going to auscultate. Okay. Perfect. Now I want you to, sit there. I'm going to listen to your heart with the bell while you're sitting. I'm listening to the aortic, pulmonic, herbs, tricuspid, and mitral. Now I'm going to test the PMI for 1 minute. Heart rate is 70 and regular. Okay, now lay down. We're gonna start off by looking for signs of JVD, and I'm gonna feel for heaves and lifts or carotid pulses. I'm palpating for thrills, none are noted. I'm gonna auscultate while she's lined in with my belt and my diaphragm. So, aortic, pulmonic, herbs, tricuspid, mitral, and then aortic, pulmonic, herbs, tricuspid, mitral. Now I'm looking at the abdomen. I'm looking for size and symmetry. It's soft, round, and symmetric. I'm going to auscultate for bruise. We're listening for, I'm auscultating the aorta, renal, iliac, femoral. No thrills. Now I'm going to palpate. Now I'm going to listen to the 4 quadrants for 5 minutes. I'm going to palpate all 4 quadrants. And now I'm going to feel for the liver. I can feel the borders, spleen. I cannot feel. Okay, come on. Back up here. All right, we're gonna move on to musculoskeletal. I'm looking at the upper body. So we're looking at joints of the hands, wrists, elbows, and shoulders. I'm looking for redness, swelling, deformities, tenderness, nodules, crepitus, everything is symmetric. Everything's good. And we're going to check calf refill on your fingers, which is less than 3 seconds. I'm going to check the range of motion first of your fingers. So flexion, extension, hyperextension, abduct. N is adduct, okay, and then perfect. Now let's do it with the wrist. We're going to do flexion, extension, hyperextension, inversion, eversion, rotation. All right, now with the elbows, flexion, extension, hyperextension, and then shoulders is going to be flexion, extension, hyperextension. All right, perfect. I'm going to assess the strength of your hands, grip. Perfect. Now I want you to push down, pull up. All right, push out, push in. Okay, perfect. We're assessing for cerebellar coordination with finger opposition. Okay, flop, and then finger to nose, and touch my finger. Now your nose. Now my finger. Okay. Stereognosis and graphesthesia. I want to tell you to close your eyes and tell me what I'm putting in your left hand.
Bobby pin.
Okay.
Q-tip.
Okay. Now I'm gonna write something in your hands. You tell me what I'm writing. Okay.
B. L.
Okay. Perfect. Now we're assessing the skin for edema, temperature, color, or upper extremities. I'm gonna test for sensation. Tell me what you feel, okay? Soft or hard?
Soft. Hard. Sticky.
Okay. All right. I'm gonna test for vibratory sensation over your medial malleolus. Let me have your wrist. And then ulnar prominence. Let me see your feet. Okay, you feel it?
Yeah.
I'm gonna test my reflexes with my hammer here. All right, we're gonna start with brachial. Let me have your wrist. Bicep. Relax. Okay, triceps. Okay. Patellar. Straighten them out. Achilles. And Babinski. Does that tickle? Okay, I'm inspecting her toes, ankles, knees, and hips for the same thing, for redness, swelling, deformity, tenderness, nodules, crepitus, and symmetry. I see none of that happening here. We're testing the calf refill. You have purple toenail polish on, but we're gonna say it's less than 3 seconds. Okay, perfect. Dorsalis pedis pulses are present. Posterior tibial pulses are present. Now we're gonna test the range of motion of your toes. Same thing, we're gonna do flexion, extension, hyperextension. Okay, we're gonna pull them apart, which is abduction. No, your toes. Fan your toes out, and then bring your toes together, which is adduction. Okay. All right. The ankles, we're gonna do dorsiflexion and plantar. So dorsa is pull your toes up. Okay. Plantar is push her down. Okay. Now we're gonna do inversion is in, eversion is out, and then rotation. Perfect. Now I'm gonna test the strength of your ankles. Push up against my hands. All right. Pull down. Same with your knees. Push. Pull. Okay. Now I want you to push out and push in. Perfect. Now stand for me. I want you to bend over just a little bit. I'm looking at the curvature and alignment of your spine. I'm checking for tenderness. I'm looking for scoliosis. I see none of that. Okay, now stand up straight. We're going to test the range of motion of your neck. We're going to go forward, backwards, right, left, rotation. Okay, so we're going to do the same. We're going to do flexion, extension. So flexion forward, extension backwards, hyperextension, lateral flexion. Okay, and then move your hips around for rotation. Perfect. We're gonna do the Romberg test. I want you to close your eyes and stand still. I see no swaying. All right, now I'm gonna test your gait. Walk towards the camera. This is normal. When you come back, do toe to heel. Come back to me. No, turn around. Come back to me, do toe to heel. A little tipsy. All right, now turn around and hop on one foot and hop on the other one. Perfect.